In this video we're going to look at lidocaine, or lignocaine as some may call it, versus articaine for dental procedures. Let's take you back and remind you of how the nerve works. So do you remember about sodium and potassium channels or gates? Sodium is negatively charged on the outside and potassium positively charged on the inside. So in this state the nerve is polarized. When there is a stimulus, then there is an influx of sodium which causes the nerve to depolarize. Now, if the depolarization level hits the threshold, then you'll get an action potential which triggers an all or nothing response and a stimulus. Now, when we apply anesthetic, it acts by the amide in the anesthetic binding to the sodium channels and thus blocking its activity, therefore preventing depolarization and neural stimulation. It's important to remember the nerve is surrounded by a myelin sheath, which is about 75 to 80% lipid based. So a good anesthetic would be advantageous to be able to penetrate this membrane easily, which, as we can see in this chart, is exactly what lidocaine does, as it's high-low lipophilic, thereby having an increased potency to cross the myelin sheath. And as you can see, articaine has low lipid solubility. However, it has a thiophene ring, which means it can also cross lipid barriers easily. So really, when we're looking at anesthetics, we should be asking what is the penetration potential of each lignocaine or lidocaine and articaine. Lidocaine, being lipophilic, is absorbed into the myelin sheath, and articaine with the thiophene ring penetrates the myelin sheath, making them both work well, but in different ways. Now we also need to consider the plasma elimination, as this works differently in each. Half-life of lignocaine is about 90 minutes, whereas articaine half-life is about 20 minutes for plasma removal. This means that articaine can be less toxic in longer procedures. And indeed, Orrital et al. Way back in 1997 showed that lidocaine toxicities were found 4 times more frequently and at higher toxicities than articaine. And this is probably due to the misunderstanding of how much is too much. Now, this is a really interesting question. So let's look at COSH information with lidocaine and articaine, and this is what we see. Here is lidocaine. Maximum dose in cartridges is no more than 3 cartridges. So in practice now, we should not really be using more than 2 cartridges for routine dental work. If you are using more than 2, you've got a problem with your technique, or you need to speed up because you're taking too long. So let's look at articaine. The limit here is 7 milligrams per kilogram of weight. So for children, recommended dosage is no more than half a cartridge for up to 20 kilograms and 1 cartridge for up to 40 kilograms. But what about adults? Well, the weight thing still exists here and is still the same at 7 milligrams per kilogram weight. So in a 60 kilogram person, that's a maximum of 5 cartridges. Now, to be fair, for plasma toxicity, you're going to have to use a lot of this, sometimes in the region of 7 to 10 cartridges. However, we don't want to aspire to this. So in summary, with lidocaine having a toxicity half-life of 90 minutes, you don't want to be using more than 2 cartridges in a 40 to 60 minute session, and a maximum of 3 in up to 180 minute appointment. Articaine with the half-life of 20 minutes, then you probably be able to get away with a maximum of 5 cartridges in a 40 to 60 minute appointment and up to 7 cartridges in a 180 minute appointment. But saying that, in reality, in the majority of cases, if you're using more than 2 cartridges overall for a routine appointment of up to an hour, your technique is likely to need revisiting. This topic and others are covered in more depth in the local anaesthesia bite-sized videos and on modules in the Real Dentist Academy website. To find out how to get there, just go to www.therealdentist.co.uk or search online Real Dentist Academy and log in. I look forward to seeing you there.